where the experts meet. Online learning, practical and sweet. Every Saturday, 9 a.m. Central Time. YouTube, Facebook, X, and LinkedIn. Online.
Hey, good morning, everyone, and welcome to UroNurse. I'm your host, Vic Senese. Welcome to the show. Hey, if you're watching us, be sure to like and subscribe to the show. Today, we got a great show for you. Our next guest is helping to refine the way we approach urinary incontinence after prostate cancer surgery. I'm pleased to welcome Eric Kolb, co-founder of Elidah, the company behind the innovative Elitone technology. Today, Eric will discuss an exciting new advancement in the management of post-prostatectomy urinary incontinence and how Elitone technology, already recognized for treating stress urinary incontinence in women, is now expanding its indications to help men regain bladder control without surgery. Please join me in welcoming Eric Kolb to UroNurse. Eric, it's great to have you with us. Welcome to the show.
Hi, Vic. Thanks for having me. Glad to be here.
Yeah. Glad to have you on the show. We're excited. We've had your wife, Gloria, on the show before. She did a great job. You know, she kind of set the bar pretty high for you. So
I'll do my best.
Make sure you don't disappoint her. All right, I'm going to bring up your slides and let you take it away. And
Great. Thanks again, Vic, for having me and giving the opportunity to share Elitone for men with you and your audience. As you mentioned, our company is called Elidah, and the product family is called Elitone. And jump to the next slide. As you mentioned, it's actually a family of products. Gloria, my wife and co-founder, was on a year or two ago to talk about the female products, Elitone and Elitone Urge, which treat stress urinary incontinence and urge urinary incontinence, respectively. Those have been on the market for about 5 years, and in total have treated over 40,000 women. I'm here today to talk about our newest product addition, which is Elitone for Men, which was FDA cleared just earlier this year, and we started selling it in the US about 2 or 3 months ago. And it is specifically approved and clinically used to accelerate continence recovery after prostate surgery. So I'm going to start off by talking about what really the difference between expectations and reality for a patient coming in to undergo prostate surgery, right? During a preoperative visit, the clinician, the surgeon, or the nursing staff will do their best to set expectations. And that's really establishing that, hey, you are probably going to leak. Most men do leak for some period of time after their prostate surgery. They will often say that, immediately post-op, we're going to have you do Kegel exercises for a period of weeks to help recover those muscles. And then at the 12-week follow-up, if you're still leaking, we may refer you out to physical therapy. And that takes care of the problem for many men. But there are a number of men who, even at 12 months, still have residual leaks. And those sometimes can be quite severe. Those men are then often considered to be surgical candidates. And there are a range of surgical options for them. That clinical reality often differs from the expected reality of the patient, where they are coming in and saying, great, my cancer is fixed. I expect to get back to normal within a few weeks. And when that doesn't align with the reality, that can create a problem, obviously, for the patient, but also for the clinical staff. So we developed Elitone for Men as a device to really help address this difference between expectations and reality and get men healed and get their recovery of continence more quickly. It uses the same technology as all of our Elitone products, and that it uses neuromuscular electrical stimulation, which is delivered through the perineal tissues. They are FDA cleared devices. They're class 2 medical devices that are available both over the counter and with RX indications. And I'll speak to that later as to how that impacts the coverage of the device. But with these three technologies, as I mentioned before, Elitone treats female stress urinary incontinence. It does this by exercising the pelvic floor muscles, by contracting and relaxing them. Elitone Urge treats urge urinary incontinence in women, commonly known as overactive bladder. And it does this by calming the signals that are telling the patient they have to go to the bathroom very frequently. And then lastly, the new product, Elitone for Men, it accelerates continence recovery immediately following prostate surgery. And it can be used as early as 1 week after the catheter has been removed. Quick design overview, looking at the image in the middle, it's really two components. One is the gel pad. This is an electrode is placed on the perineal tissues. And then there's a handheld control unit, which connects by a wire to the gel pad. And that allows the patient to modulate the intensity of the signal that's going into their body. The cartoon image on the left shows the approximate placement with the anterior portion of that gel pad going directly behind the scrotum and wrapping around towards the anus. And in that position, when it's turned on and activated, the signal moves through the pelvic floor muscles, causing them to contract and relax. Image on the right shows how generally it is worn against the skin and under clothing. This is key in that it allows the patient to get dressed and move around during their treatment. It's applied and used in really three simple steps. First is to apply it. As I mentioned, the front part goes directly behind the scrotum, lightly adheres to the tissue, put the clothing on top of it and move around. The blue regions are the conductive regions of the electrode or gel pad, and those are lightly tacky or adhesive, but they are not so aggressive that they pull hair. They're specifically designed to be applied over hair for easy, comfortable removal. Once the gel pad is applied, the patient increases the intensity by hitting the plus or the minus buttons on the controller to achieve a strong but comfortable contraction of the pelvic floor muscles. The design is very simple. It's just two buttons, plus and minus. Once the proper setting is achieved, the patient then turns it off. Or, sorry, the device runs for itself for 20 minutes, giving the full treatment session, and then turns off automatically. We recommend using it 20 minutes per day, 5 times per week for 6 to 12 weeks. And most men are using it discreetly at home while they're doing other things and amongst other people. Your viewers can certainly visit elitone.com/men for more detailed product information that could be helpful for them, including some videos. So the next question is, well, that's great. How well does this work? So as I mentioned, this is an FDA cleared device. The FDA for a product like this does require clinical data to be submitted with the application. So we did this. That was part of the clearance process. And this data that we submitted to FDA was also recently presented at the AUA annual meeting down in DC. Basically, the study design is we send the device to the patients. They start using it a few weeks after the catheter has been removed. They use it in that suggested regimen of 20 minutes per day, 5 days a week for 12 weeks. We measured 24-hour pad weight at baseline, 6 weeks, 12 weeks, also recorded daily logs and IQL scores, satisfaction, et cetera, and reported the results. What we found is that in the 24-hour pad weight assessment, which is our primary outcome measure, there was a 92% reduction at 12 weeks. And with daily leaks, over 80% reduction, and the IQOL score changed by over 20 points, which is almost order of magnitude more than what the FDA considers to be clinically relevant. From this, we're really able to establish that our device, compared to a standard kind of self-directed Kegel regimen, greatly accelerates the recovery of continence. The image on the bottom right shows that data with the blue line representing self-directed Kegels, the green line representing Elitone at corresponding 6 and 12 week time points, And what you see is that for the Elitone for Men device, at the 12-week check-in, the continence recovery has been accelerated by over a month, which is certainly meaningful to patients and to the clinicians that are treating them. All right. So after establishing that the technology works and is well tolerated by patients, then the question usually moves to, okay, well, how do my patients get it? Interestingly, all Elitone products are approved for both over-the-counter and RX indications. That's a bit unique in that typically when a new product is introduced to market, it gets a prescriptive indication first, and then through ongoing testing and demonstrated safety, a company can apply for an over-the-counter indication. We, knowing the importance of using this product at home and that many patients are hesitant to even talk to their clinicians about incontinence, we went for an over-the-counter indication right from the beginning, and we're successful in getting that for all of our products. So a patient can go to elitone.com or cvs.com and buy the Elitone product directly. They're also HSA, FSA eligible, which helps defer the cost a bit, and we offer payment plans. If a patient has Medicare Part B, it is covered, and our company Elidah is accredited to bill Medicare directly. So clinics can send us their prescription. We can work with the patient to process that insurance and get the product to the patient very quickly. It does require a prescription. We provide a detailed written order form that can be filled out that makes sure all the information is accessible, that would be relevant for getting the Medicare approval. In those cases, the out-of-cost to the patient is about $120 versus about $449 currently for the male product if they buy directly from elitone.com. For commercial payers, both Medicare Advantage and in the commercials, the coverage varies. We work with the patient to assess their eligibility and then work to find the best solution for the patient to save them the most money. I will note that when the patient buys the device, they're getting or goes through insurance, they're getting both the controller kits, which includes the handheld unit and the wires, as well as 9 weeks worth of gel pads, which are used typically 3 to 4 times per gel pad and then thrown away and a new one is used. Okay, for clinicians to get access to Elitone, they're doing so in a variety of ways. Some are becoming prescribers and referrers and simply sending us their prescriptions, and we work directly with the patient to fulfill those. Others are acting as resellers in that they are purchasing the product wholesale from us, stocking it in their clinic, and then selling it at the MSRP or billing insurance directly through their clinics. And then another benefit of prescribing or using Elitone in the clinic is that there are some billing codes that can be associated with use of the Elitone device that can total up to about $300 in additional revenue for a clinic if billed correctly or appropriately over a couple patient visits. And we can provide those CPT coding suggestions separately. For sure. I'll add on the right that, even though we are a small company, we do maintain the highest standards of medical device production. We are, as mentioned, all our products are FDA cleared. We maintain ISO 13485 certification, which is the medical device requirements. And the original Elitone is CE marked for sale in Europe and around the world. At one point I mentioned the detailed written order, which is our prescription form that we can provide to clinicians, and then they get sent back to us via email or fax, again, making it very easy and reliable approvals through the Medicare process. And then since this is a clinical crowd, I will spend just a minute talking about the differences in the stimulation signals that we output, because that question always comes up when we talk about a product. So on the left, shows the signal for Elitone and the new Elitone for men, and it is outputting a 4-second period of muscle stimulation that contracts the muscles. So that's toning, followed by a 2 seconds at a calming signal, and then 6 seconds of rest. So for those who are curious about frequencies, it's a 50 hertz signal for 4 seconds, a 10 hertz signal for 2 seconds, and then a rest period. This is different than the Urge device, which solely outputs the 10 hertz calming signal followed by 6 seconds of rest. And then both those patterns repeat for 100 times in the 20-minute period. Interestingly, we also use something called a carrier wave that helps to get the stimulation signal through the skin and the fats barriers more comfortably, and allows us to get enough energy into the muscles to be able to elicit the right response. So that's something that's a bit unique to our device, being a externally applied simulation device. Nick, I think that's it for slides for now. I'm definitely happy to turn it back over to you to ask some questions.
Yeah, sure. That was great. Yeah, I've got a few questions myself I'm going to ask. So the system for men, is it able to treat both urge and stress incontinence?
Right. So right now it is only FDA cleared for treating continence recovery after prostate surgery, which is typically going to be stress, right? And the signal that it outputs is the exact same signal that is used on the original Elitone device for women, which is for stress incontinence.
Okay. All right, good. Yeah, I tell you, you've got a harder road ahead of you than Gloria had on the female side. Females will put up with a little bit of incontinence and not even complain. Men, couple drops and they're in the office complaining. And sometimes you're like, dude, you got rid of cancer. You understand? That was our primary goal. Of course, we do everything we can to maintain your continence, but it's going to take a while. So it's
Yeah, we hear that from clinicians like yourself very consistently, and in these surveys we do that are more market research. Yeah, the men complain a lot. They complain a lot.
They don't tolerate it. So having options for them is great. And obviously what it's really trying to simulate or do is what we call Kegel exercises, contracting that pelvic floor, which is what we always treat patients, or our group anyway, teaches patients ahead of time to do Kegels so they know how to do them, and then they do them post-op. But reality, people don't tend to do them right. I've taught a lot of men how to do them, and they're contracting everything but the right muscles. Right. So I think that this takes the guesswork out of it because it's going to contract the proper muscles, correct?
Yeah, absolutely. I think there's published data on women performing Kegels, and I believe it's 20% are not able to perform them correctly, even with coaching from an expert like yourself. And I would suspect that for the men, it's even much worse than that.
Yeah, absolutely. We'll take any questions. I see a couple of things that have come in here, so let's bring those on. Are there specific types of severity of post-prostatectomy incontinence where Elitone appears to be most effective? So is this like the worst case, or the ones that are just having a few drops?
Yeah, so because we are initiating treatments at about, call it 3 weeks post-op or a week after the catheter is removed, many of these men have severe incontinence. We're talking hundreds and hundreds of grams of urine per day, right? And now then most of them do recover pretty quickly. So we're trying to accelerate recovery, right? We haven't done, because it's a new product, a lot of research on use of the device for someone who is, after surgery, been incontinent for 6 months and then begins to use Elitone. Don't have that data just yet because, again, we are new. But I will say that on the female side, our studies had women that were using up to 5 pads per day, which is pretty severe leakage. And they saw just amazing results. So I would expect that to carry through for the men as well.
Yeah. And we do have some non-clinical people that are watching the show. Can you kind of describe what the men are going to feel when they use the device?
Sure. So it is there's a slight sensation on the skin where the gel pad is attached to the perineal tissues. That's going to be kind of a tingling sensation, right? And then as they increment the controller up in its intensity, they'll begin to, at some point, feel a muscle contraction internally. And it's a bit of a lifting, and maybe almost a posterior lifting of the pelvic floor muscles. And then as they increase that intensity, that muscle contraction is going to increase and become larger. At a certain point, in increasing the intensity, it will become uncomfortable. And then we recommend at that point, dial it back 1 or 2 clicks and then let it run its course.
Yeah, good. Now, in another difference with male to female, you know, a lot of men are pretty hairy down there. And anytime you try to put tape or anything around that area, you're really going to probably have poor adhesion. Do you guys recommend shaving or?
Yep. So we recommend trimming both for men and women. We generally don't recommend shaving, in that shaving gets down to the skin and can irritate the skin just through that shaving mechanism and leads you to increased risk of infection or irritation. So yeah, trimmers, great, but not all the way to shaving.
Yeah, so something like the beard trimmers that you can just
beard trimmers, great. Yep,
without nicking the skin. Yeah,
exactly right.
All right, we did have another question here that came in. Can you share the results of studies evaluating Elitone in men, including improvement in pad usage, leakage episodes, and quality of life measures?
Yeah, so I spoke to some of that in the presentation, and that was published at the AUA as well. So I think on the AUA website, you can get the abstracts for that. In generally, the IQOL changed about 20 points. That's the measure we use for a subjective quality of life score. The incidence of the number of leaks per day dropped by more than 80% over the 12-week time period. And then the kind of the gold standard test that we use is a 24-hour pad test. That's where for a layperson, the patient basically wears a pad all day long. They take it up, put it in a bag, and then they weigh, the difference between the after use versus pre-use weight of that pad. And in many cases, it's going to be 5 or 6 pads during the day. And then we monitor the change in that pad weight or the leakage from the baseline. And we saw at 6 weeks, I think it was 68%, and 12 weeks, it was 92% from the post-operative baseline.
Yeah, that's huge. I mean, that takes annoying incontinence down to maybe something you can, tolerate.
Right. And you'd expect it to keep continuing after that, right? So we would not, if you've used for 12 weeks and you've seen massive improvement, but you're not quite where you want to be, for all means, keep using it. And we do, again, with the women is our biggest baseline of data, because we have 40,000 patients, and we recommend a maintenance schedule. So you'll do the first 6 to 12 weeks at that 5 times per week type of pacing. But then after that, reduce it. Go to maybe once a week, a couple of times a month, to really help maintain the progress that you've made with the device. Let your body kind of tell you what to do.
How long has Elitone been in this business?
Yeah, so we started the company 10 years ago. Wow. And you mentioned Gloria. She was patient 1. We had 3 kids. She had incontinence issues, like many women do after multiple deliveries. She was not happy with the options she was presented with from clinicians, and both of us being engineers, we said, hey, we can do better. So we made prototypes, got funding from National Science Foundation to develop those. And over the course of about 5 years, we were able to bring the product to market. And then in the last 5 years, we've spent commercializing it, getting it out into the hands of clinicians like yourself, and developing new products like Elitone Urge and Elitone for Men.
And the male side has been out how long now? We
just received FDA clearance earlier this year. And the first commercial use of it was really kind of the April timeframe. So it's really very new.
Very new. All right. Another question came in. Should patients begin using it shortly after surgery, or is it appropriate for men who have been incontinent for months or even years?
Yeah.
So we what's the best zone and what's the worst case?
Earlier is better, right? You want to get these muscles in your pelvic floor after surgery have undergone a significant trauma, right? They don't know how to behave correctly. So by using Elitone, you're retraining how these muscles
Mhm.
behave, and the earlier the better. So we recommend beginning treatments about 1 week after the catheter has been removed, which is about 3 weeks after the initial surgery.
Can you actually order it for somebody pre-op so they
That's what
have
we
it?
recommend. Yeah, is that
Yeah.
a physician would preoperatively say, "Hey, our clinic's program is for you to utilize the Elitone device. We're going to have you order it ahead of time. I would recommend that you try it once at least before the surgery, so you know how it feels, how to operate it, ask any questions you might have, and
Yeah.
then after treatment, after surgery rather, you're just ready to go and begin that regular 5 times a week treatment."
Yeah, that's great because that's the ideal time to work with patients is ahead of time because post-operatively, they're in pain, they've got a million questions, they're worried about everything from their pathology report to you know it's not a good training time. So yeah, I like that.
Right. Yeah. Yeah. We're seeing more and more of that. I think as the community becomes more realizes the
Mhm.
importance of that prophylactic type of approach to training the pelvic floor, that more and more clinics are taking that approach, which is wonderful. But as you mentioned before, not all men are necessarily compliant with that. They're going to make the time to
Yeah.
come in and or have access to maybe a pelvic floor physical therapist. So we see this as a great tool for really, making that prophylactic uh, awareness of the pelvic floor a key part of the treatment pathway.
All right, we do have another question that came in. Prior to ordering Elitone for men, are there any additional requirements needed prior to approval by Medicare, such as testing for incontinence with urodynamic studies or failed pelvic floor physical therapy? Or can it just be used, I guess, as first line therapy after prostate surgery?
Yeah, so it's a great question because for the women, that's a very relevant point. Medicare does require that they have failed pelvic floor muscle training. It doesn't have to necessarily be with a physical therapist, but some form of training, which generally be just 4 weeks of Kegel exercises.
Mhm.
For the men, it's a little bit different situation because they're beginning to use right after their surgery. So there isn't the time to have tried and failed PT. So no, it's just no specific requirement for Medicare other than having had that index prostate surgery.
And if you need to use this long term, you said it comes with so many pads and would last you, I can't
Yeah,
remember
the male kit comes with the gel pads. They're in a 5-pack, and you get 3 of these 5-packs. So it's 15 gel pads, which is enough for 9 weeks of treatment or longer. And after that, you can order more of the gel pads on our website. They're $33 for a 5-pack, so very affordable.
that was an ask.
Not
Are they fairly
prohibitive
inexpensive?
at all.
And
Yeah.
obviously the Elitone system itself is rechargeable.
Absolutely. Yeah. We've had, again, the women's side using the product for 3, 4, or 5 years now. And they just keep it. And whenever their body tells them they need to tweak those muscles a bit, they
Mhm.
plug it in, recharge it, and start treating.
All right, great. I do think we'll get time for one more question here. Are there any ongoing clinical trials, future indications, or new innovations that you're particularly excited about for treating urinary incontinence? Oh, somebody wants to know about the future.
Sure. So, not surprising, right, that we would be considering a male version for the overactive bladder
Yeah.
community, right? The men at a certain age begin to have overactive bladder in the same way that women do. There's a lot of nocturia, right? Getting up at nights to go to the bathroom, and we
Hmm.
believe that the same stimulation signal we're using to treat the women would be just as effective as on men. So we're looking into that. Um, another, I guess, considering longer term later use of the Elitone for Men device. Right now, as I mentioned, we're really indicated for immediately after prostate surgery. But there are obviously men who have stress incontinence that may be lingering more than a year after prostate surgery. So investigating the use of Elitone in those patients, I think, is going to be important. And then there are other things we're considering, looking even more broadly, like for the female space for pelvic pain is an area we think neuromodulation has some opportunities as well.
Yeah. Might be also something you should look into for the males, because there's that chronic pelvic pain syndrome that males experience. They go in and they think they have prostatitis, and it turns out it's not.
Not
And
that, yeah.
we've had some success with sending them to physical therapists for muscle relaxation.
Yeah,
And
yeah, we do
that's
see that with the physical therapists who are using our product for the female space and the male space. When a patient has hypertonic pelvic floor muscles, often to the point where the physical therapist has a hard time even introducing any internal tools or assessments. They have been using the Elitone Urge device to calm and relax the muscles for a period of time, so that then the patient their physiology is relaxed enough to be able to do some of the treatments and modalities that can then help restore function.
No, I'm excited to see the future. I think, as we were talking before the show, I have some back issues myself and been using a TENS unit, and it's been remarkable how much that's improved. We're talking drug-free therapy. You don't have to worry about other side effects. You turn it off, the effect goes away, but the long-lasting effect is there. So these are exciting times.
Yeah, the application of electrical stimulation, neuromodulation on physiology is broad, and we're really seeing that extends in the last several years. Interestingly, these treatment types have been studied for 40 or 50 years, but it's only recently that they've become, put into form factors with the current hardware and software to make them very user-friendly and home use devices that patients can actually benefit from.
Yeah, that's great. All right, we're going to put a little plug in for next week's show.
Can artificial intelligence help healthcare professionals educate patients more effectively? In this episode of UroNurse, host Vic Senese explores how Notebook LM is changing the way urology nurses, advanced practice providers, physicians, and healthcare educators create patient education materials. Join us on July 18 at 9 a.m. Central Time to learn more.
Yeah, you're going to want to join us next week. I'll pull away the curtain and show how a lot of this educational material can be created using AI. It's going to be scary good. I can tell you that right now. Sometimes I get surprised myself how good it can be. So join us next week for that. Eric's been a blast having you on the show. Really enjoyed it. Hopefully we'll get some future time. Maybe we can get you and Gloria on to kind of give us an update on how both products are doing.
We'd be happy to do that. And thanks for having us, Vic. We appreciate it.
Yeah, great. All right. We'll see everybody next week.
So here's to the mornings, the coffee, the monitor glow, to the wisdom he shares and the folks that he knows. Saturday is special when Vic's on the stream with 40 years of knowledge and a head full of dreams.